Hey future nurses, let's simplify hypo and hyperthyroidism and everything NCLEX expects you to know about it. Then I have put together NCLEX cheat sheets on hypo and hyperthyroidism on my YouTube channel as Scrub and Spoon, and this is good for the PN and the RN students. So go review this before your next exam. Now let's go. Hypothyroidism is when the thyroid gland is underactive and it does not produce enough thyroid hormone, the T3 and the T4 hormones. This slows down the body metabolism. Okay, remember in hypothyroidism everything is low and slow, and also in hypothyroidism the T3 and the T4 hormones are low and the TSH, that is the thyroid stimulating hormone, is high because it's trying to help the body or make the body produce more T3 and T4 thyroid hormone. Major cause of hypothyroidism is Hashimoto's thyroiditis, among every other. Key signs and symptoms include cold intolerance, weight gain, constipation, bradycardia, dry skin and brittle hair, depression or mental fog. The main treatment for hypothyroidism is levothyroxine. Remember, leave some thyroid in, right? Levothyroxine is taken early in the morning on an empty stomach, and it is a lifelong therapy. That is, they continue to take this for the rest of their life. And while your patient or you are taking levothyroxine, remember to avoid calcium and iron supplements within 4 hours of taking levothyroxine. And another thing you need to know is severe complications of hypothyroidism or untreated hypothyroidism will lead to myasthenia, coma. That is some NCLEX tip right there. Now let's go to hyperthyroidism. Hyperthyroidism is when the thyroid gland is overactive and it produces too much thyroid hormone, that is the T3 and the T4 hormones, and this leads to high metabolism in the body, right? Just remember, with hyperthyroidism everything is high and fast, right? And in hyperthyroidism the T3 and the T4 hormone is high and the TSH, that is the thyroid stimulating hormone, is low because it is trying to reduce the production of the thyroid hormone in the body. Some of the causes of hyperthyroidism is Graves' disease, thyroiditis, that is inflammation of the thyroid medication overdose, and goiter. Key signs and symptoms you will see in hyperthyroidism is sweating, palpitation, unexplainable weight loss, excessive hunger, heat intolerance, hypothalamus. Remember, hypothalamus is always key signs. So when you see hypothalamus, regardless of other signs you see, just know they're talking about hyperthyroidism. Okay? Diarrhea and moist skin, among others. Now, treatment option for hyperthyroidism, the first one is methimazole, and this is used to reduce the production of thyroid hormone, right? And the next one is PTU. Remember, put the thyroid under, okay? Key importance in this one is it is good in pregnancy. Another treatment option is SSKI. This helps to shrink the thyroid gland, okay? And radioactive therapy, this helps to destroy the thyroid cell or the thyroid tissue, and it's reduce or decrease the production of the thyroid hormone. This particular one is contraindicated in pregnancy, okay? And the last one is thyroidectomy. This is removal, either partial or total removal of the thyroid gland. Also, an NCLEX tip for you is that remember, untreated hyperthyroidism or complications, severe complication of hyperthyroidism is thyroid storm. That can show up in your exam. All right guys, I hope I have been able to simplify hypo and hyperthyroidism, and now you know the difference. Take care.